I'm Steph. I am a consultant in advanced internal medicine at NUH. Advanced internal medicine is like my clinical specialty. With internal medicine, people branch out into like cardiology, nephrology, etc. And then there's a bunch of us who prefer being generalists. So that's the specialty of advanced internal medicine. So we specialize in taking care of patients within the hospital setting, people who need hospitalized care. But I also do that for patients at home. What we do is we take care of patients who otherwise should be hospitalized in the hospital, but at home, and we deliver that care to patients in their homes. When I learnt about this particular system of taking care of patients at home, which has been done in Europe, the US, Australia for many, many decades, for example, I was also wondering whether or not this is something that could be helpful to our Singaporean patients. So, of course, it's not for everybody, but there are patients who do require hospital-like care, but are otherwise quite clinically stable. For this group of patients, in general, the studies do show that they sleep better, they walk around a bit more, they eat better, and they recover better in the comforts of their own home and around their own family members. The hospitalization environment is actually quite a change for many of, especially the older patients, to have to pick them out of where they are very comfortable with to stay in a completely foreign environment for a few days. Does actually take quite a lot out of them, and for some of the older patients can cause them to decline in their function just even a matter of a few days. We've been doing a whole bunch of studies since we started in 2020. The earlier studies was really about attitudes, and even before we started, we surveyed patients to say, if this exists, is this something that you want? Is this something that you want to go home? We surveyed doctors. We published about our early findings, both in general medicine patients as well as later on during COVID, when we took care of lots of COVID patients at home. We have a couple of comparative effectiveness studies that we're currently doing, and the cost effectiveness one is underway as well. I think for me, it was important that when we were starting a brand new system of care, we also needed to almost intertwine the research component with the implementation. I think sometimes we are very quick to implement things without evaluating it fully, or we try to evaluate things and it may not be possible to implement it. It's very sort of futuristic, theoretical, in the future kind of thing. So I'm interested in trying to combine both together so that we can start implementing things that are useful for our patients, but at the same time effectively and rigorously evaluating it to understand whether what we're doing is right and effective, and if not, which are the areas that can be further improved on. I guess I've always been interested in how do we take care of our patients better. I think when most of us went into medicine, we are thinking about how do we treat an individual patient, and as we progress through our training, I start thinking about how can we improve the systems in which we practice in.